to help me with your young eyes with the reading the
My young eyes don't work that distance. My young eyes work this close.
Good morning.
Hello, everybody.
I'm here. I'm Dr. Maryam Bakhtiari, the inventor of Bella Lip Appliance, and I'm here with my bestie and co-worker, and she's going to help me collaborate in teachings of Bella Lip Appliance and certifying in future. But I have Sylvia here, who is, people used to tell me that have so much knowledge, but I will let you know that Sylvia is, I bow to her as far as she's gone, and the knowledge she has acquired from yoga to body to physiology, and incorporating all of that into healing from within. Let me say that. And I have her as my guest today, and I'm guest in her show.
Yes, we
YouTube
got
show.
multiple cameras and we have multiple microphones, so I'm going to be handing my microphone over once in a while. Thank you so much for having me today.
Of course, Sylvia. Of course, Natalie in our Amazon Live is missing. She may join us a little bit later, but she's stuck somewhere important, and we're just going to go on without it. So let me go ahead and give you a little bit about me, and I'm going to then let Sylvia talk a little bit about her. Yeah. So my name is Dr. Maryam Bakhtiari, and I am a dentist, specialized in, my practice has been focused in the fields of TMJ, sleep apnea, and orthodontics for over 30 years. And during all that exploration and learning, I came about to understand that when I align somebody's mouth orthodontically, it doesn't mean necessarily their muscles, right and left hemisphere of their face, their muscles are balanced through my process of orthodontics. Here in my practice, when I have a misalignment, we usually use orthopedic retainers to fix the misalignment, and then we go with braces, orthodontics. Sylvia is one of my patients, and she's now in the orthodontic phase past the appliance therapy. But with this phase, without an appliance that works out the facial muscles, we couldn't get patients to be balanced, facial symmetry, and be able to have younger looking face. So when I started thinking about Bella Lip Appliance, is for my Amazon Live viewers, Bella Lip Appliance was a device that I invented along with an aircraft engineer and a physician to be able to work out the facial muscle, so to make the right and left muscles balance, at the same time engaging muscles that we normally don't work and lifting those muscles and tightening others, stimulating the facial blood circulation and enhancing beauty, at the same time balancing our facial muscles. And while doing it, I learned as a TMJ specialist, a lot of the exercises and the tools out there actually presses the jaw joint. What can I do in this field that, excuse me, to teach patients or my clients to do this exercise and at the same time alleviate TMJ? And at that point of my practice was when Sylvia came to my life, and she had the chance through one of her friends to see the Bella Lip Appliance, and she approached me and had my first Facebook, is that Facebook?
It was YouTube.
Oh, YouTube interview that we did standing up in my desk, and she was so excited and she interviewed me, and that was a lot of people watched it on YouTube and Facebook and so forth. And since then, I would say maybe prior to COVID, she's been collaborating, and she has taken the exercising device to a different level, where now we feel that it's important for people that teach it to be certified, to know the facial anatomy, and to bring the awareness to the public that this exercising device is not just for the face, that if you even had one session, which I was lucky to have with Sylvia, you will learn how you can incorporate your face and connect it to the whole core, the back, the shoulder, your trauma. So she takes you to a lot further down the line. So having all of that said, I'm going to, from my Amazon live, I'm going to pass the podium to Sylvia.
Yes, thank you so much for sharing that. And I get super excited about the BLAfit because it's really what you do with an amazing little device. You shared before previously that plastic can be used in so many ways, yeah, and it depends on what you do with a certain object is what you can get out of it. So I get super excited about functionality, and I think and I believe and practice and teach that form follows function.
Form follows function. It is completely true.
So what this means, you guys, if you don't know what we just said, is that how you look is really dependent on how you are functioning as a human being. Yes. And I'm getting goosebumps, you guys, because it's not just about, you know, a muscle or a joint functioning well, which we need. If we have TMJ disorder, we need that jaw joint to function correctly so we can function in life and have capacity and energy to be a decent human who has a capacity to have joy.
And help others.
Yes. What I also mean is that being functional and sourcing that radiance from inside, and this is something we both agree on with Dr. Maryam, is that when you are a balanced human on the inside, you radiate that to the outside. Mm-hmm. And I have this theory, this belief that your fascia, which is the connective tissue that connects you from head to toe, is your muscle of, it's not just a concept, it's proprioception. It's your organ of proprioception, sensing and feeling yourself in relationship with your environment. So when we do the training, you guys, when you do the training with the BLAfit, and you do it in the way that I teach you, with mindfulness, with awareness, with a sense of like a meditation, like yoga, then you tap into the realm of fascia, the realm of energy, the realm of spirit. You generate that glow from the inside.
You guys, I know that some of you have already Bella Lip Appliance and agree, and some of you don't have it. When you do these exercises and you add the breath work and do the right movement, you connect the fascia in a way that you can, with the jaw exercise, you can actually connect to your pelvic floor, release your neck pain and inner trauma. This is not something that we're making up.
No.
We're two professionals sitting here. We both are completely BLA users. I know I invented it, but I'm also a believer and a user. A lot of people make products that are not using themselves, medications that they don't. Whatever I talk, I use. And when form follows function, what it means in my book is if somebody doesn't have the right function in their jaw, they don't have an aesthetic face. And if you can put as much makeup as you want and recontour your face, if your function is perfect and correct and is in a very decent function state, then your cosmetic and outer look will shine through that. We can't make one without the other. So when I have patients that are come with their children, and I mean their parents, and I treat about maybe 40% of my population of patients are children. And when they come accompanied by their parents, and they're telling me, the parents are always telling me, oh, are you going to widen their arch too much? Or is their jaw coming forward when they have overbite? Is that going to make their face change? I always tell them, if I could open their airway and blood supply to the head and give them the right function, that would be their most aesthetic form at the end. I don't even think about the aesthetics. I will only focus on the function, and toward the end, look at the before and after. We have hundreds of cases that we can display of showing how when you fix the function, the form changes. Now, we're talking about an exercising device that is less than $100. we're looking at an $85 device. We're not talking about full orthodontic treatment. We're not talking about full alignment. We're talking about a device that will be changing. Did you bring yours?
No.
A device that will change your facial symmetry, but it's not going to be the only solution for your function problems. Sylvia knows in order to fix a lot of our functionality, we need to really go delve deeper and make orthotics and go through braces to be able to get the jaw function properly. But if you are not capable of spending $7,000 to $8,000, or you're far from civilization where you don't have a clinician like me around you, Bella Lip Appliance can kind of mask and help you go through, get the best out of an $85 device. Let's say
Absolutely.
that. You get the training, you have the Bella Lip Appliance. Sylvia and I are in our Instagram and we follow each other. Sylvia _ pelvic _ alignment. If you follow us, you will see Sylvia. We post her stories oftentimes, and you take her classes. Now you will become master of your body with just an $85 device. What I mean is, the best you can get from that is to be able to learn the breath work, connect your fascia, even though when you bite down, your function may change to the old function, but at least we can stimulate and increase the place that is corrected where the blood supply, I'm gonna have you hold this, Sudhi, where the blood supply is opened up to the brain, moving the jaw forward and allowing the parasympathetic activation and our autonomic nervous system to be in a very healing state, and take that to a next level where going with Sylvia, you will learn how to get the trauma within. She was telling me I have arm pain, how she's going to help me with my shoulders, stabilizing my muscles behind my shoulders so that my arm pain is going to be improved, and so on and so forth. So you're taking it a different level. You're here to get the most holistic healing approach to human body with the least expensive expenditure, right?
Yes, and I think the thing is that you guys, there's so much stuff out there. You are bombarded with information and products, and not many of them are backed with science, real science and real practicing doctors whose job is to reduce pain in your face and jaw. And you know, the neck is always affected too. How many people you see with neck tension?
100% of my TMJ patient have neck tension.
Exactly. So this product is backed by a practicing doctor, developed by a practicing doctor. I am a user of BLAfit device, and I include it in all of my coaching courses.
That gives me goosebumps now, because I am using it in my practice. It's my invention. I believe in it, and I know that there are few dermatologists that are trying to use it to give their patients better neck posture and better jawline. But I know when I train my patients how to use it when they have TMJ, every TMJ patient in my practice has to buy and invest an $85. They invest $5,000 to $7,000 for their TMJ. They do not care another additional $85. But I want to tell you that this is their physical therapy in the house to get their jaw relaxed, to get themselves centered. And we will teach them. Everybody that buys gets a complimentary 5-minute training with us, but we can't include any more time because we have a lot of clients and we have a full-time practice here. But we turn it to Sylvia because I don't know anybody that is a user, has taken the Bella Lip Appliance to a next level. I tell my patients, you want to learn the Bella Lip Appliance to the next level where you get your pelvic stronger, where you get your neck released, where you get your inner trauma with the breath work, take her classes. And we have here a little flyer that connects people with Sylvia, because in my field, My specialty is TMJ. Her specialty is healing, yoga, Bella Lip Appliance. She's a certified instructor. She's our first certified instructor in our facility through Bella Lip Appliance, and she has done exams on anatomy, on training. So she's our only instructor, and we're going to open that door soon to more clinicians that want to be certified instructors so that they can train their clients to it. But for now, we only have Sylvia as our first and only female trainer.
I feel
So I give her the podium. But because she was interested and she knows physiology of human facial muscles, I can train you how to use it. But if you don't understand the amount of muscles that overlay in our facial structure and connect this face to our rest of our fascia, you'll be not understanding and be able to train. There's so much. We have 50 plus muscles in our facial muscles, where one overlays another doing a different function. This is a very, very complex exercise with a simple device that the torque, the amount of maximum opening, everything is calculated by me, because I'm not worried when you put it in your mouth. If you're trained by us, you will not hurt yourself. But if you don't take advantage of your free training and connect with Sylvia, then I don't know how you're using it. Yeah. And I know in Amazon Live, we had people that, 1 or 2 people that said, oh, their jaw clicking didn't get better because they didn't take advantage of their training. And I DM'd them and told them that, take advantage. Come in front of the camera, let me see you. Let my trained staff see you to tell you exactly what you need to do to get what you need. There's tons of products are out there, and these products scare me, give me goosebumps that people are actually putting it in their mouth to get their face firmer and more chiseled, and it's 100% creating TMJ, and I've had patients with lockjaw using some of these products. So you're getting a product that's made by me, which I am for 30 years treating patients with TMJ. Our facilities, TMJ, we have people flying from LAX to here, going back, being treated by us here. I don't want to brag about us, but we are we are one practice in the entire world that does TMJ, airway, orthodontics under one roof with a knowledgeable doctor who I am. And I loved this field because everything is so interconnected. That's why I'm so fascinated by Sylvia, because even though the medical part of these I understood, but the fact of connection to the trauma, and I'm interested in psychological and healing. We're all like into healing today with all the social media out there. We all want to heal our inner child, our trauma from the past. There's not one person in this universe, I don't care if you look at them and you think that they're happiest on Instagram, that doesn't have childhood trauma that's carried with them throughout life. I am fascinated how she takes the Bella Lip Appliance and what she knows, connects them, and heals your inner trauma and inner childhood trauma that you carry with you.
It's everything what you just said right there. And I work with a lot of people. I attract a lot of people who are jaw clenchers. I'm looking at you straight in the camera. Jaw clenchers. When you use the BLAfit, it is actually this vertical exercise is actually helping you to lengthen the muscles right here that are being shortened.
And from clenching, you've tightened them, you shortened them, and it just keeps pushing your jaw back at night.
So it's not going to make, using this product is not going to make your jaw more tense. This is a common question I get from my clients, from my followers on Instagram. Is it gonna make it more tense? No, you guys, when you do it correctly, when you lengthen, and she's gonna show you when you move the jaw forward, is when right there you're lengthening this muscle here that is responsible for clenching. So instead of numbing and paralyzing the muscle with Botox, which I know many of you may be thinking about to do, or maybe you already tried before, Instead of that, you're learning an intelligent training for the muscles, and that you're not only just training this muscle here, but you're working the invisible deep layers of muscles that are actually also responsible for your airway and helping and lifting the cheekbone. So again, what did we teach you early today is that form follows function. So when you train these beautiful functional muscles, they become prettier too. There's blood flow. This is what you will feel the first thing when you start using the BLAfit, is that you did work out.
So I feel because we have the resistance, this round thing in there is a resistant weight that we put in there enough to be able to get you work out without creating trauma to your jaw. I've had people ask me, do you have one that's stronger because they've used it for 2, 3, 4 months and now they feel like they need something bigger and stronger? I would say, yes, we do. It's coming in 2024. We already have our second generation coming up, but the first generation you can use for years, and you just have to change the slowness and tension by holding longer. You'll be able to get that workout done. We can't have too much weight on a jaw that just started stretching. It's kind of like I go to a gym and all of a sudden they give me a 200 pounds weight. I'm going to really traumatize my muscles and injure myself. So you got to work, I would say, at least a year to a year and a half with the first generation, and then we can take you to the next level and walk you through it. And it's not for everybody. Just like weight training is not for everybody. I'm using the second generation after 3 years of my first generation, and you're on your second generation now. And how long you had the first generation?
Probably 2 years.
2 years. So here's a master. She used her appliance for 2 years before she started the second generation. We will surprise the audience for second generation in 2024, but only if you are a first generation past your test user. So we will have you to show that you bought the first generation and you've had it for over a year, and second generation is mandatory training so that we can get you in and make sure you're doing it correctly, your forms are correct before giving it to you. We're looking to see how we can get that done. That's why we have the second generation, but we're not selling it until we know we have the right protocol that's for your safety out there.
I also want to add to that we're talking about very small muscles and very intelligent muscles that require very specific training.
Yes.
This training is non-existent out there other than us, okay? Yes. Because of that, you guys need training, and you have to understand and undo this whole collective ideology around exercising.
Yes.
I want you to forget about the more is better, or going for your next, heavier weight or more resistant band. No, you need to actually undo and forget all of that and learn how to turn on your subtlety, your muscles of being able to be present with sensation in your body. Because those of you who are clenching and having the jaw disorders, you are chronically disconnected from your soul.
Yes, I agree.
And you need to learn how to come back and return back home safely. And this is the exercise and training that we teach you. It's not enough just to buy your device, okay? You need the education that these guys can give you. And actually, I send my clients who sign up for four-digit trainings with me. They pay a lot of money to work with me, but I tell them, did you schedule your session with these guys? Because they need to learn the basics.
I have to tell you that today I think we're more and more in tune with our body, and we want beauty and we want to be the best version of ourselves, and sometimes we're impatient and want to do things quickly. I will tell you that quick fix is not the prettiest fix. And today we know that people that do Botox and they do a lot of fillers to be able to enhance their facial beauty, they don't look really good after. Maybe the first shot, they kind of look like a little bit more lifted, but after the second time, and this needs to be repeated every 5-6 months. The third, we now know that fillers are not being absorbed by our body, but they told us all along that it will be. Now people have injected, now their faces looks fatter. Now you have to go in and draw them back because now their faces are rounder, bigger, looks like it's swollen. Their lip is out of shape. So for me, I really love to see somebody aging gracefully. I'm going to be in 4 months in January, I'll be 56 years old.
Wow.
And I don't have any foundation on. The only thing I have is a lipstick, and I like to put just a bit blush, and I make my own serum at home. I don't even put facial cream. The Bella Lip Appliance, since 3-4 years ago when I was the only one that was doing all the testing and learning and experimenting. When you look at my wedding pictures from 25 years ago, this October will be our 25th anniversary. And now I go to parties and people tell me that you look better than 25 years ago. It's not that I'm not aging. I see myself aging, but it's not like letting my face sag. And like Sylvia said, less sometimes is better. We only require 1 minute a day doing the Bella Lip Appliance, but also for workout, I do less now. I do wall Pilates, do less but more engaged work than more and not be present. To be engaged, even with the Bella Lip Appliance, I always engage my core when I'm doing it, so that I'm aware about core workout, posture, breath work, and exercise. It's a whole body connection. Unfortunately, we don't have the facility or the full knowledge to teach you how to make this exercise to become a face yoga, but we'll give you the basics, and we're hoping that you'll be interested enough to your wellness to be able to delve in deeper, because this Bella Lip Appliance has saved so many souls from their inner trauma with her work. I see them because they come later on for their TMJ treatment referred by Sylvia, and they tell me what she has done for them. So I know she's not a a psychotherapist, but I will tell you she is. To me, Sylvia is a psychotherapist, a physiologist, a yoga instructor, and somebody that's really in tune with her body and experiments things where she has added more and more gigs to this exercise to be able to get you completely in a right direction of your health and wellness.
Yeah, and when we were talking about the topic of beauty, and reverse aging and slowing down, or I don't know what's the best way to say it. This is what came to me, this thought, is that real beauty is not how you look, but who you are.
That's another thing to say. You're right.
And because if you think about it, is who you are on the inside. If you are able to be a balanced person and you are integrating your jaw and facial exercising routine with your core, with your legs, how you stand in the world, who you are, and you radiate that truth to the world, and you become a healthy citizen of the world. You're no longer a toxic human, or you're no longer entertaining toxic interactions with people. You become a non-toxic person. You literally become energetically non-toxic.
You guys, she's talking and I'm getting goosebumps because she radiates everything she talks about. And I'm
hard
still
work I've been through.
I'm still experimenting and learning. She's absolutely correct. You guys all had moments where you're next to somebody that she's so beautiful to you because of what she radiates, the calm, the presence she has, and she's holding space for you. And you've been around people that are so made up, but yet they're not even listening to you. They're on their phone, and as pretty as they look for the seconds, after a few minutes you look at them and you're just not very taking too much from them or learning anything from them or their presence bringing you any joy. I love this lady, and this morning I got up, I was so excited that I'm going to be with Sylvia. We're going to start our own podcast soon. We're practicing on that. But it's really important to surround yourself with people that hold that space for you, and she is one, and I hope I'll be one for you, that we can learn and touch more people in our lives. This life is limited. I tell this to my two beautiful children, that you have a specific limited path, and we're all going to get to that ending. As much as we inject Botox and do BLA and all of that, we're going to one day go and become Mother Earth and part of the soil of this world. What happens in the process, it's important. How many people, I mean, for me, having a path, having an ideology, having a goal in life, that's what gets me every morning up and gets me excited. How many people can I touch? For me, every patient that I help, give them their life back and take them out of their trauma is important. And I'm learning that as a clinician, as a physician, I need to sit down and listen. Instead of looking at just the physical problem they have, I listen to their pain. And sometimes it's their trauma from the past that brought them to my office for their TMJ problem. And if we could just fix the physical component, we're not completely healing. Sometimes just holding the space and listening and putting them in the right path is all it takes. So that gets me up every morning. Every human being, every person that comes here, that I can touch their life and hold a space for them, it's my going on. It's never been about monetary, and it's never been about anything material. It's all about our soul, what we have for each other, what can we learn from each other. So that's the space I hold.
It's so deep and so beautiful, and I know both of us share the same wish,
yes,
to the world, that we make this healing more accessible. I know that medical treatments and TMJ treatments are so expensive. So on one hand, this is a very low cost solution.
I wouldn't say like a full solution, but
No,
it's
but
a very
something
good modality
to do something.
to get you to actually very good healing
Yes.
for low cost.
And the more you guys gonna get and do something, and you are able to afford to buy this device, because I do get it, there are some people who can't, even $85. But those of you who can afford it, and you know who you are, you're already spending on cosmetics,
Oh my
you're
goodness.
spending on
Hundreds
massage,
of dollars.
you're spending on Starbucks coffee, you're spending on a lot of stuff, okay? So those of you who can afford spending on a new bag, you can afford spending $85 on BLAfit. Then with your purchase, the more you guys purchase, the more we can also make healing accessible to the people who are really in need. Besides you, I know you are also in need, but this is also our mission, to help people in need.
Yes,
Yeah.
yes, yes.
So go buy the BLAfit.
Well, it's even when I invented Bella Lip Appliance, I had the idea when I met with some marketing executives that I was introduced to. They were all telling me to market it as a medical device, and it cannot be cheaper than $300 because you're giving your expertise.
Yeah.
And all of that jazz sounded good, but I didn't want that. I wanted to have something that I'm able to afford,
Mm-hmm.
and I'm not planning to get rich from a Bella Lip Appliance, but I refuse to bring down the quality of the product. I was just talking about it to Sylvia. The product that we're handing to you can bear 400,000 cycles before it cracks.
That's a lot.
That means 2 years, at least to 3 years of usage of a daily 1 minute exercise, 2 minute exercise before you need to buy another one. So you're buying a durable device made in USA with the medical grade, FDA approved nylon, coloring, and we're making it in California under my supervision so that quality control is up here. I've had people wanted to buy the Bella Lip Appliance and they wanted to make it a infomercial $19.99 product, and I left their presence. I had stars and actors and models that wanted to collaborate, but they wanted this to be again a $19.99, $29.99 product.
No.
But they wanted to take over the production and send it to China, other countries to be able to make it, and I said no, and I left with my husband, because our goal is not to sell 1 million and people throw it down the trash and they use it 2 months and it cracks. Our goal is to make something that's got high quality, durable, has our support, and yet nobody's going to become millionaire from it, but then I'd be able to make you so healthy with our union so that you'll be able to get maximum for your buck. I mean, I can't say you're getting 5 minutes. The 5 minutes that you get with us on one-to-one today, it's actually at 20 minutes sometimes. I see Natalie 20 minutes talking to you out there. And those of you that wrote beautiful reviews for us know that we spend, and I come in most of the time and I look at your face. That is, anybody walks into my practice has to pay at least minimum $225 to see me for half an hour. You're getting all of that because there is no way you'll be able to use this product if you just look at the instructions pamphlet. Please remember that. You need to learn how to use it. It's a small device, looks simple, but the facial muscles, the facial anatomy is so complex. This is only 2-dimension. We have so much blood supply, nerve and artery integrate with this 50 plus muscles. You need to be trained. So these people that sell these big things you put in your mouth, they need to worry about your well-being, because we have such a vascular region that we're working with, and this is a roadmap to our brain. We can't do things that clenches us back and constrict this supply. We can't have the jaw clench. The system of rejuvenation is to unclench. So do all that workout with being unclenched is a trick to this.
Yes, and 2 things I want to share here. One, I will never forget when you said something about Botox. We've been talking about Botox for a very long time, you guys. If you don't know, if you haven't followed us, we have a lot of talk about that. I never forget when you said something about you as a doctor, as a TMJ specialist, yeah?
Mm-hmm.
You would never inject somebody with Botox without a ultrasound, or what did you say? Something like that?
Well, it's when this facial structure is very vascular, and there's so many people have been injured through Botox and fillers, and my husband is a physician, he'll testify. You really need to have somebody that's really knowledgeable to do those injections. Even though I don't recommend, I can't stop people from doing what they are recommended by their physician. Now Botox has advertised so much that they help with muscle clenching, which I really don't believe in it personally, and my husband doesn't believe in it personally, because we don't like the idea of injecting a toxin to your muscle to paralyze it in order to help you with pain. To me, that's not a smart thing to do. To learn a right pattern of movement to open that area and get the muscles to do the right thing is the right thing to do, without adding a toxin to our body that we don't know yet what it will do in 20 years, 30 years. We don't have long enough study on that. And with the fillers, they told us 10 years ago, 15 years ago, when they came out, that it's resorbable. Why did it take so long, 15 years, 20 years, before they found out now that it's non-resorbable and it displaces? So now we know that I don't want my patients to experience something that in 20 years, these toxins will do something else to their organs. I know myself personally, that I don't put anything in this body that's not pure. I totally believe that other than what we're talking about, what goes in your mouth into your body needs to be pure source of food. I am really leaning toward fine-tuning your nutritional needs. And I do take a lot of good fruits and antioxidants in my daily diet, and I think that also contribute to my skin tone, to my hair shine, and things like that. So it's not just what we're doing, you need to also, but so that's why I don't want to put anything in my body that's toxic. Why would I want to do that? If I learn the right pattern, and that's where she's going to put you, so you can learn the pattern of clenching, why we're clenching. What does that pattern come from? How to change that pattern to a face that's really relaxed, a body that's really present, and connect these fascia together in a place that works for us instead of causing ailments and disease. We know now that the trauma and the childhood stress and all of that is why we have more high blood pressure, we have most of our health issues really arise from carrying this trauma and being in sympathetic nervous system and this anger, and all of that causes vasoconstriction, and closing that dilation to the rest of our body could cause issues. So we know learning to be present and relaxed and Zen, it's one way of healing. We know meditation is healing diseases, cancer. So we know that that is important, but also the nutrition that goes in is also important. Maybe we can talk about nutrition another time, but that would be another topic for another day.
Yes, you guys, the BLAfit is a wonderful, non-toxic, non-invasive solution to train an area of the body that nobody in the world will train you correctly.
Yes.
Even the face yoga people. I'm not going to get into that.
Oh yeah.
But that's not functional training.
Yes.
It's not functional training. Yeah, so again, I want you guys to think about why you want to do something about your facial aesthetics. Is it because you want to look good, or is your motivation to become a functional human? And I encourage you to go for being functional, because what happens when you're functional?
The form is beautiful.
Yes, this is the secret. Form follows function.
Yes. Well, that's
Mic drop.
yeah.
Cut.
Yeah, I think that was a good ending.
Yeah.
Do
we have
any
comments? I don't know. All right, guys. Bye.
We will see you hopefully soon for my Amazon guys. I'll see you next week. Hopefully Natalie will be here and we have maybe talk about nutrition a little bit and what I take for my anti-aging as nutritional supply, what I put on my face, and delve a little bit deeper on BLA. And I will invite Sylvia if she would love to be in that space with me. She's always welcome to be a guest here.
I love it.
And I may even see if I could get a guest nutritionist next time that I know in my mind right now, one of my patients, that I can see if I could get her to be here as a nutritional expert. But I will tell you that I am also a nutritional expert. I've studied a lot about nutrition. I don't have a certificate, but I hold certificate for myself as much as I know about nutrition, different foods and different sources of different vitamins, and I have tons of knowledge about that. Until next time.
Yes.
Okay, so that was good.
Yeah.
So if we can just